No, please. We're live. Good morning and welcome board and online viewers to the May 6, 2026 Board of Health meeting. The board meeting is officially called to order at 7:32. This virtual meeting is being streamed via YouTube and will be rebroadcasted later on Facebook. The April minutes were distributed to the board for the review prior to the meeting. Remember, in compliance with the Open Meeting Act and its guidelines, which states everybody voting should be seen and heard.
We have a quorum.
We have a quorum. Okay. Are there any discussions or amendments to the minutes? If none, okay, Ms. Margulis, move to approve. May I have a second?
Second.
Thank you, Dr. Hedges. All in favor, please raise your hand and say aye. Aye. Aye, everybody.
Okay, yes.
Thank you.
We're voting and waiting.
Any opposed, please raise your hand. Any abstentions? Motion approved as distributed. Thank you very much. May is the Mental Health Awareness Month. It's just like, your serendipity that we're again having a presentation related to the awareness. And this awareness focused on community connection and supporting particularly youth with the color green representing hope. The highlight date is May 17th, when Children's Mental Health Awareness Day happens and is celebrated. So this is a really nice coincidence. May is also the National Stroke and High Blood Pressure Month, where education on cardiovascular health and prevention. And the highlight is May 17th for the World Hypertension Day. Let's keep in mind that mental health and heart health are deeply connected. So if we support emotional well-being, we are also at the same time supporting cardiovascular health and vice versa. So that's why it's important for mental health should be as part of caring for the whole person. May is also the Women's Health Month, where promotional health screenings and wellness for women are promoted. Also Cystic Fibrosis Awareness Month. And I realize Kentucky has its own celebrations and awareness. It's Asthma and Allergy Awareness Month, ALS Awareness Month. So let's keep this in mind and bring everybody to the table. On our perspective session this month, we will have 7 counties. The presenter is Dr. and Deacon Scott Thomas Hedges. He is the Chief Medical Officer, Chief Information Officer, and Director of Laboratory Services at 7 County Services, Inc. This is the Regional Mental Health Center for Louisville, Kentucky, and surrounding counties. Dr. Hedges is also a clinical faculty member in the Department of Psychiatry and Behavioral Sciences at his alma mater, University of Louisville School of Medicine, and serves as a consulting psychiatrist at St. Luke's Institute in Louisville. He has served in so many boards and right now is the medical director at Lil Wade Pregnancy Center. And he also does a lot of volunteer work. Today, I present to you Dr. Scott Hedges. If you're ready, we can go.
Thank you very much. Very kind introduction. Well, I appreciate the opportunity to speak, particularly in May, to the board related to 7 county services and mental health services, behavioral health in the broader sense. You'll see what I mean here in just a second. One of the disadvantages of asking somebody who's been practicing for so long is you get maybe a little bit of history that you might otherwise have avoided. So as was alluded, back in the 60s, after John F. Kennedy deinstitutionalized and transformed behavioral health services, Kentucky was actually on the advancing front of the best way to navigate that. And they created a variety of regions around the state. And they were created to be the planning authorities for behavioral health services at the time. And 7 counties was one of those regions. And if you haven't figured out, 7 counties has, it was originally called River Regions, and then changed its name to 7 counties. 7 counties is a very creative name because we serve Jefferson County and the surrounding 6 counties. Isn't that amazing how that works? And we are deeply embedded into our community in lots of different ways. What you see, well, part of what you're going to get today is our regular slide deck in terms of PR. But our main mission is to helping more people thrive. So just a brief overview of the company. 7 County Services is, it depends upon the year, but the first or second largest non-hospital nonprofit in the area. Just to kind of give you a couple of elevator numbers, we have roughly around 1,200 employees, about 27 different locations spread in those areas, and an operating budget north of $100 million. Yes, we are really struggling, you know. $100 million. And that's just kind of a broad area. We serve obviously Jefferson County, Oldham, Bullitt, Shelby, Spencer, Trimble, and Henry, which provides some unique aspects because Louisville is the largest metropolitan area. So we have a very urban service area with the issues that are associated with urban areas. And then it doesn't take too long in Kentucky before you get into very rural areas. And by the time you get to Spencer and Trimble and Henry, you've gotten into some pretty significant rural areas and the issues that impact them. 7 County Services is, we refer to it as a behavioral health organization because we provide both mental health and addiction services and developmental disabilities. That's really our core sort of 3 elements. Is the mental health services, the addiction services, and the intellectual disability services. Next slide, please.
Next.
I'm trying.
Oh, sorry.
My finger's not working.
Thank you, sorry.
And so that's the reason why I mentioned we often refer to it as, this is internal lingo, as behavioral health, because we see it as a combination of a variety of services. And then recently, in the last 6 or 7 years, we've added that primary care in the bottom. Our venture into primary care has been intentionally discreet and well circumscribed. Our goal is, because we don't see ourselves as a primary care health deliverer, there's lots of community partners that do a much better job at that than we do. But what we do see is that in our own internal morbidity and mortality reviews, the large number of deaths that we encounter that are not related to behavioral health, suicide, those sorts of things. People die because of cardiovascular disease. They die because of metabolic disorders. They die because of smoking issues. And they're not involved in care. Over the course of my career, I've seen, I don't know how many cases I reviewed where individuals die of these diseases and have not been to see their primary care physician for a long time. And so we have a subset of a population that getting them into any of our great healthcare providers, whether or not it's Family Healthcare Center or Park Duval or Northerners or University, is near impossible. But they will come to us. And because of that, we started a small primary care delivery services, which has had some remarkable success in that unique patient population. We see ourselves, this is our internal, and we hope to continue to build on this brand, but that we are central to public health outcomes, healthcare utilization, and community safety and stability. Here's another little piece of history. Some of you may remember Dr. Troutman when he was here many years ago. And that's actually when our relationship with the Board of Health began to solidify. And it occurred, I mean, we had some connections before then, but it occurred through mechanisms that really were outside of both of our control. And if you were around at that time, Hurricane Katrina came through in the Gulf, and many of the individuals that were dislocated ended up here in Louisville. And they were encountering people in the areas where they were serving those refugees, those displaced citizens with serious and persistent mental illness. And they reached out for help, and we actually opened a clinic in the middle of the, I think it was a convention center, if I remember correct. And that really began a long-standing relationship with the health department. I mean, we had some connection before, but really began to see opportunities for collaboration in that regard. And I think in the course of my career, I would say that behavioral health is no longer sort of a parallel system. It's really sort of the backbone, as Madam Chairman suggested, in our healthcare system, our community system, long-term outcomes. 1 in 5 people have been touched by behavioral health or addiction services or intellectual disability. So we just count the number of people in this room. Statistically speaking, there's going to be a number of you in this room who either personally or with first-degree direct relatives have had experienced these kinds of issues. And I talk about parallel system because one of our ongoing issues is our funding mechanisms still represent that adoption of a parallel system. And so you have the Medicaid along primary care health lines for reimbursement, and behavioral health and addictions along another mechanism of reimbursement. And that made a lot of sense at one time, but now when there's so much effort at thinking about integration, those parallel systems can often get in the way of successful outcomes. Next slide, please. In 7 counties, we see a rising level of depression, anxiety, trauma-related disorders, substance abuse. Kentucky, particularly along the interstates and in the mountains, have some of the highest opioid-related deaths of any state in the nation. And the use is really prevalent. In 7 counties, about 70%, 77%, it fluctuates depending upon the year, are below a poverty line, and we serve about a 55% racially diverse patient population. And to say nothing about I'm sure Family Healthcare Center and the Health Department experience this, but the language diversity as well. Louisville is truly a diverse community, and not just along the lines of Black or white, for example, but the number of individuals that come from Hispanic-oriented countries, from Asian-oriented countries, from different countries in Africa. I mean, in Middle East, we see all kinds of individuals and languages and the challenges that are associated with that. And you might imagine, this is true whether or not you're dealing with metabolic disorders or cardiovascular disorders, but if you're struggling with a significant disabling disorder, including behavioral health, and you don't know English, navigating our healthcare system is a significant challenge. And honestly, for most of you in here, you try to navigate your own healthcare. As competent healthcare providers who are fluent in English, you've probably run into issues and trying to navigate it. You can only just imagine if English is not your first language and you're in a culture that is very different from yours. So trying to navigate those issues is a challenge. Next slide, please. So I want to talk about a couple of different areas that we provide services on. And I put this one right at the top because this is a hotbed discussion in our community right now. And so the idea of crisis services in our community is a rich and complex public discussion, even as we speak. And I'll touch on it a little bit more later. But it's a topic that many voices have a vested interest in. And the question really becomes, what is the best way in a community, this is my way of phrasing it, but what is the best way in our community that has limited resources that we provide urgent and emergent access to services across our system of care? And that includes children and adolescents and adults, individuals with substance use disorders. And that seems like that should be a pretty straightforward question, but it's really a complex question. And we'll talk a little bit more about that. 7 counties is embedded in a lot of the kinds of systems in our community that provide first touch points. So our relationship with the emergency room at the University of Louisville is longstanding. Emergency psychiatric services, which probably most of you in the room are familiar with, is a partnership between the hospital system, between the Department of Psychiatry, and between 7 counties, and actually the state, because Central State Hospital, or the state through Central State Hospital, provides funding to help support that, and EPS is the admission unit for Central State Hospital. And that partnership has existed since I started at 7 counties, which was 35 years ago. So it's a long-standing collaboration in our community that's been there as a backbone to serve the needs of the community reliably over the course of time. In addition to that, our criminal justice system has a number of touch points with 7 counties. The jails actually have their own system, but I include them in there to ask a trivia question. So who would guess what is the largest mental health provider in the state of Kentucky? Any guess? It's a setup, but
Yeah.
yeah, it's the criminal justice system, hands down. They dwarf 7 counties in terms of the number of services provided. They dwarf the VA, they dwarf, I mean, you name it. The criminal justice system is the largest behavioral health system in the state of Kentucky, which, by the way, my sense is that if you talk to wardens, if you talk to policymakers, if you talk to criminal justice experts, they would not advocate that as a good system for the delivery of behavioral health services. And I would tend to agree with them. But that's how we have evolved in our state for one reason or another. So it's important to keep them in mind. In addition to that is our police. We have embedded units. I'll talk a little bit about them in just a second. I, in fact, am one of the trainers for CIT, and it's a huge gift for me personally, to meet with all of the new recruits that are coming through, both with the Louisville Metro Police and also with the state police officers. We do the CIT training for both. And I've been doing that for a number of years with a variety of other collaborators in the community. It's just a great opportunity to help educate our upcoming law enforcement officers about issues to be aware of in terms of people with severe and persistent mental illness or substance use that they are going to encounter in the community. 988 is a primary mechanism for accessing crisis services, and it's really shifted demand. I've kind of alluded that crisis care is really an infrastructure question in our larger community. And that's a picture of our mobile van right there. We got a couple of those that we use across the system. Next slide, please. Just some summary slides. So we provided close to 500,000 services. We over 50,000 telehealth services in the span of Kentucky, a little around 645,000 people. You can see us where we're geographically located, and the little yellow dots are our various locations. So just kind of a diverse numbers. Relatively small percentage of veterans in our particular community, but that's because we have the VA system in our backyard. We have a great working relationship with them, but they provide a lot of services in our area. Next slide, please. Oh, before we go, can you go back for me for just a second, please? I just want to point out, note the 988, almost 100,000 calls in a year. It is remarkable, the volume that we encounter in our area. So it's a very active process. Okay, thank you. Continue. I want to say a word, because not everybody here might be familiar with the language, about the distinction between a CMHC, or a community mental health center, and a CCBHC. So in healthcare, as all of you are very familiar, we like to throw around acronyms like there is no tomorrow. And you can almost have an entire conversation without actually saying a word, if you're fluent in anachronisms. But it's helpful to have an idea of the distinction between the two, because it's critical. So a CMHC is a community mental health center, and it's largely a state-defined entity. And that was what was born out of the regional formation for 7 counties when the region was defined. And its primary purpose is to deliver core mental health services to that particular region. And it's largely driven by state regulatory and state funding mechanisms. That's a key aspect of it. And it is programmatically based, and often, I'm embarrassed to say this, but often access can be very challenging to navigate, because you have to figure out what is the right door to get into a particular program, and because of the nature of how those systems are set up. The state of Kentucky brilliantly started from the very beginning at the federal process of participating in what's called a certified community behavioral health center. Now, I'll spare you the politics behind all of that, but it's sort of, if you tilt your head to one side and look at it a different way, is sort of an equivalent to, in the behavioral health world, that federally qualified centers are for the primary care world. That's not exactly a fair comparison. There are huge differences, not the least of which is like 340B pharmacy pricing and so on. But it's similar. There's some comparisons, and one of those is that it's federally defined, and they impose certain elements that are beneficial to our larger community. And one of those is the requirement to provide comprehensive services, including primary care coordination, which is kind of new for community behavioral health centers. And there's no wrong door. This is one of the reasons why you may have noticed, I hope you've noticed with a positive experience, that we now have only one line for access to services. We've moved to, there's only one number to call, and that access number will get you any service in the community. You can walk into any of our locations and receive services for anywhere in the system of care. The whole idea is no wrong door. Now, do we do it perfectly yet? No. We're working on it. We're continuing to process, improve, so that the experience really is there's no wrong door for people to enter into, and that's driven by this model for CCBHC. Next slide, please. So the 7 counties provides care from birth to death, and We see both infants with our intellectual disability disorder, move into our child and adolescent care services, our programs for transitional age youth, particularly emancipated transitional age youth who may be living on the streets, our adult services, and of course, our addiction services and intellectual disabilities throughout the course of life. Next slide, please.
You have 2 minutes, Dr. Hedges.
2 minutes. And we do great work. So here's just a summary of our adult services. Next slide, please. He says a couple of slides here. This is for addiction services. Next slide, please. Here we have for our child, teens, and families. Next slide, please. We have the extensive services available in rural. I will point out in this particular point that rural and Jefferson County are different in the sense that rural is sort of you can get all the services in one location, whereas in Jefferson County, we divide those out for economy of scales. Next slide, please. Intellectual disabilities, all those various services. Next slide, please. And our crisis center. I'll take a moment, if Madam Chairman will indulge me for just a second, that I wanted to comment about the emerging dialogue at the community level about what is the best way of serving our crisis services. And honestly, there are perspectives that we have, there are perspectives that the hospital systems have, there are perspectives that Metro Louisville have, there are perspectives that the state has, there are perspectives that the federal government has. And 80% of the time they all align, 20% of the time they don't. 7 counties has largely tried to stay to the SAMHSA model, which you see right up here. And the SAMHSA model is based on the idea that you have someone to talk to, someone to respond, and a place to go. And so as we've tried to build out our crisis response systems, we've tried to follow the SAMHSA model in that process. And someone to talk to obviously is like 988 in crisis, someone to respond, mobile crisis, emergency services, place to go. This is where the hotbed conversation is EPS, does that serve all the needs or should it be different levels of services in the community? And that's an ongoing community conversation as it should be. Next slide, please. We have a huge, deep ecosystem that we provide services and lots of partners. The slide isn't large enough for me to list all of our partners. We have great friends in our community. Next slide, please. Money. So we're largely a Medicaid provider, but we see a variety of others, but I won't bore you with too much of that. Next. And we're pretty much out of time. And just a couple of unmet needs that most of us experience. Workforce. Finding doctors and nurses and therapists and peer support specialists is huge. If there's any way that we can partner with our institutions of higher education to develop long-term work, really, I think it has to start in high school, to be honest with you. It's too late by the time you get to college. Housing availability and instability is huge. Care fragmentation, these are all issues that our community faces, and it impacts all of us. Next slide, please. And then just a couple of ideas of where we can go next. Looking at continuing integration, workforce pipeline. Did I mention workforce? Leveraging CCBHC for the system, mobile and community-based care expansions, and the ongoing dialogue associated with that. Next slide, please. And the role of public health. Clearly, public advocacy. This is a great way if we can partner. There are some great discussions that are going on about how best to provide for our community, and the Board of Health can provide great leadership in that area. Next slide, please. And just a foundational statement. Next. And here's ways you can get involved. That concludes my slides. Thank you very much.
Thank you so much, Dr. Hedges.
Questions, comments, thoughts? Yes, sir.
Scott, I know Seven Counties is going to open a 24/7 crisis response center at 914 East Broadway. Could you say a little bit about that and when that might be online?
Yes, so again, this is one of the areas where there is ongoing conversation internal to the community. And so 7 counties participated in a community discussion about what should best meet our needs. And one of the ideas that came out of that process is a place similar to what we used to have as a living room. But it's the idea of a lower medical model. So it's not a hospital-based environment, but it provides an opportunity for people that are in crisis to go to have an opportunity to decompress a little bit. So it's not intended to be an emergent care, so it won't have holding facilities. It won't have the ability to do mental inquest warrants or to hospitalize individuals. That would have to be referred to the hospital, but it would provide a mechanism to provide an intermediate level of services for folks. That came out of that community discussion, and we moved in that direction. We partnered with Metro Louisville to try to help get some funding to help move in that direction. And that's part of that a place to go sort of model. The idea is that it would be staffed 24/7, and it's supposed to go online in the summer. The goal is July 1st, is to have, and July 1st will be second shift. So we'll do it in staged process. We'll bring second shift online. 3 to midnight is the goal for come summer. After that, then the first shift, we give our shifts right, midnight to 7 in the morning. We already have during the business hours covered because you can go into any service site.
Dr. Scott,
Yes.
it's Heidi. Very briefly, I just want to commend you on decades of service of top quality, not only across the community, but nationally as well. And we are, and I speak for myself, and I know a lot of other people, you all certainly are best practice. Thank you so much.
That's very kind. Thank you very much. I appreciate that.
And I do have a comment also. 7 counties, along with the School of Public Health and Louisville Metro, are spearheading a collaborative of several organizations related to mental health or behavioral health. And we will invite the coordinator for this collaborative to share. And this, the crisis place to decompress is one of the main necessities identified through this work group. And I, just like Heidi, I commend 7 counties because the 988 number has been meaningful for so many in crisis. And just the everyday life is, enough to sometimes feel overwhelmed. Imagine if you are, seeing your community struggle. So even members of our community with different languages can call and can find the comfort and the resource of an ear that is willing to listen to them. So thank you so much. Anybody else with a question or a comment?
I will close with one comment. As would be true for, I think, almost any program represented by the board members, that was a whirlwind discussion of what 7 counties is and does. There are so many programs. I didn't even talk about our deaf and hard of hearing program or our diverge program. I mean, there are so many things that are just hidden gems in our community. And it's just, it's a joy to be a part of the larger health infrastructure within the community. So thank you.
Thank you. Thank you, Dr. Hedges. Thank you so much for your time. And now we will continue our agenda and allow for and space for our updates and reports. We'll go back to the mayor's office update, but for now, we are going to our director's update. I yield the floor to Louisville Metropolitan Health and Wellness Chief Health Strategist, my good friend, Connie Mendel.
Hi, thank you. Good morning. Everyone should have a copy of the report in their packet that was emailed out earlier this week. To add on to Dr. Hedges' presentation, Jefferson County saw record-breaking decreases in fatal overdoses. So this is good news. A 33% decrease from the year before, which actually experienced a 30% decrease from the previous year. So we're finally back to pre-pandemic levels, and some of the lowest overdose deaths that we've seen in a decade. Still far too many. So there's still work to be done, but, and part of this, we estimate that that is from a whole government response to overdoses. So when we talk about prevention, harm reduction, connecting people to treatment, as well as providing basic needs such as housing and social services. So, and I'm also, we're very happy to see that in the mayor's fiscal year 27 budget, there are allocations to increase and to continue some of these services. So, good work.
Well, in the partnership too, we got a great partnership with.
Yeah, so still more work to be done. We still, and I don't have the final numbers for Jefferson County yet, but we still lost at least 236 Jefferson County residents last year to fatal overdoses. So still work to be done, but progress is good. Just a quick note on Derby festivals. Hopefully everyone had a good Derby season. I'm sure we all had the winner. But sharing that our food safety team does hundreds, over 100 food inspections, I think over 200, and we'll continue those throughout the warmer weather. So this is your buyer beware as we get out and we're in outdoor events. Look for those inspection cards on your food vendors. Look for good, safe food handling practices. And also as we picnic and camp and enjoy the weather, make sure that we're using good, safe food handling practices. We want to prevent anyone from getting sick based on foodborne illness. So other information in the report, again, we talk about community mental health. The health department is partnering with the Office of Social Services, Louisville Metro Department, in providing suicide prevention training. We have QPR, question, persuade, and refer. So we've had over 100 employees, Metro employees participate. We're encouraging Metro employees to participate. We're encouraging employers to offer whether this or other suicide prevention training. Talk about suicide. Let's remove the stigma. Let's continue the conversations about mental health and suicide. Ask the questions. We cannot promote 988 a month enough. We continue to promote 988 that is 24/7. So it's not only a call, but you can also text. So we encourage everyone to share that. And the last bit of update, unfortunately, our WIC clinic is still not in service at Newburgh. We talked about that last month. We experienced what was a small fire. All of our employees, clients, everyone safely exited the building, but the damage was a little bit more than we initially anticipated. So a little more extensive work to be done. So we're providing the majority of those appointments via telehealth. For new clients or those that need it in person, appointments are available at our other 3 locations. We hope to be open, I'm gonna say August. So, but just sharing that information. And we are still taking new clients. So we always want to promote our WIC, Women, Infant, Children program that provides needed nutritional and other services to our new mothers, families with new children or expecting children. And that's it for.
Sir?
Yes, ma'am.
Okay, just a quick note, and you will remember Amy Acton, I believe, from the COVID days. She is running for governor on a Democratic ticket in Ohio, which is wonderful. Sarah Moyer and I work directly with her. I don't know if you remember, but she would make an absolutely fabulous governor, but more importantly, carry the banner of public health.
Thank you for sharing, Ms. Margolis. Thank you so much, Chief Health Strategist. And we now proceed to the Mayor's Office update. I yield the floor to Deputy Mayor Nicole George.
Thank you. I just want to give a couple of things. One, I'm so happy we're here in person, and I appreciate all the coffee and refreshments. One of the things I know Mayor wanted me to convey was just the gratitude that we have for the role of the health department in helping make Derby possible and all the Derby festivities. You guys do such tremendous work, and of course that runs in the background often, but is really front and center in terms of being able to execute safe events out into the community. So we are appreciative.
Thank you very much. And now we are going to proceed to Family Health Centers. Now yield the floor to Dr. Bart Irwin.
This brief announcement that where Sam on June 1st will take the leadership position at Family Health Centers as CEO. And I hope to stick around and be involved in a couple of special projects, Community Care Campus and the respite program there, and the renovation of the Americana World Community Center convent.
Two projects integral to the community.
Thank you so much. And yes, Dr. Irwin just mentioned it. It's his last meeting with us, and we are so grateful. I would like to recognize your retirement and your contributions and dedication to the Louisville Metropolitan and Wellness Board of Health. We have been, counting with your regular attendance and participation and bringing up to date everything related to family health centers and how to contribute to the health of our community. So thank you so much. Congratulations on your retirement, but I know you're not going. Now I identify.
Any two of those projects.
Yeah, so enjoy the extra time you have, every minute of it, and it will be rewarding, and I hope it's fulfilling along with those two projects. Thank you so much. Thank you. And we're looking forward to receive your updates starting in June. And we got now to healthcare coverage and outreach with, I would yield the floor to Ms. Ashley Shoemaker.
So the coalition met on April 13th. The primary topic of conversation, two things, was child renewals for Medicaid, which are still ongoing. We continue to see children losing Medicaid coverage overwhelmingly because families are not responding to the notices to complete the renewals. So we want to continue to encourage families to make sure that their contact information is up to date and to respond to notices as soon as they receive them. The income limits are much higher for children than they are for adults. So don't assume that you don't qualify. Chances are that the child is still, eligible for coverage. The other main topic of conversation was House Bill 2 and giving updates on House Bill 2, which recently passed. That largely aligns, state policy with federal, guidelines in terms of Medicaid work requirements and Medicaid redeterminations every 6 months, which will be starting in January. So there will be more information about that, as we get closer to 2027. Finally, I do want to mention with the marketplace plans, we are seeing people begin to lose coverage due to non-payment. We expected some churn because the premiums are higher this year than they have been in previous years due to the expiration of the enhanced tax subsidies. The most recent data I have is that statewide, almost 6,000 people have dropped marketplace plans, largely due to non-payment. If someone drops a plan due to non-payment, they will not be able to re-enroll again until next open enrollment in November, start again until January. So we want to encourage families, if there are any changes to your income during the year, report those changes as soon as possible. Because, you could be eligible for additional tax subsidies, or you could be Medicaid eligible. You can enroll in Medicaid at any time during the year. So I want to remind people to report their changes, in a timely manner. The next coalition meeting is scheduled for June 8th at 4:00. Does anyone have any questions for me?
I do. At the meeting on the 13th, were there any new ideas discussed for increasing child renewals? Anything innovative, new partnerships? Yeah.
I know that, that a lot of connectors are working with Friskies at the schools, to try to outreach to families. And of course, as we head into summer, we'll be doing, health fairs, other, community events, trying to get out there into the community where families, go, during the summer and outreach to them that way.
Thank you.
Thank you. Thank you, Ms. Maker. Appreciate it. Orlando, do we have Dr. Wang?
No.
So for Immunizations Advocacy Committee, we don't have anything to report today. Regarding the Community Advisory Board for JCPS Health, Dr. Eva Stone.
Dr. Stone is not here, but Nichelle Neal is. I don't know if she has any updates.
Ms. O'Neill, do you have any JCPS news or reports to share with us?
No, I don't have any updates. I just know that this summer we are working to try to get some immunization events locally in different neighborhoods for our students. So we're still trying to figure all of that out. And I know at the last meeting we were talking about some collaboration in the community. So as soon as I do get with Eva Stone, we are going to try to sort that out for this summer, and then I can bring back that information for you.
Thank you very much, Ms. Neal. Appreciate it. For Greater Louisville Medical Society, I yield the floor to Dr. Jeffrey Goldberg. Dr. Goldberg.
A couple things. At a previous meeting, we had discussed the concept of getting dashboards publicized within the medical community. The board of GLMS has enthusiastically endorsed that. And our staff will continue to work with the staff here to focus on which metrics we want to publicize. But we intend to get those out both on our website where they can be updated regularly and also in our monthly newsletter. Also, since it is both Women's Health Awareness Month and in light of our excellent presentation today, wanted to highlight efforts from GLMS and KMA to promote a new Kentucky program called Kentucky Compass, which is essentially 988 for women's healthcare providers dealing with mental health issues. I don't know if everyone is aware, but we do have a fairly robust maternal mortality review committee now in Kentucky. We're no longer seeing high rates of maternal mortality from cardiovascular disease or hemorrhage or infectious disease like we used to. The number one cause of maternal mortality in Kentucky is mental health issues, and specifically substance use disorder and postpartum depression. Most of the time when people present with these issues, they're not presenting to mental health experts. They're presenting to their OB, their family practitioner, nurse practitioner, people who are very good at recognizing there's a problem, but maybe don't have the depth of expertise in what to do about it. So recognizing that need, Kentucky created Kentucky Compass. Please don't ask me what the acronym stands for. But you can go to the KentuckyCompass.org and get all the information on the program. It's a way for any healthcare practitioner to access information for women with mental health needs related to obstetrical care. So we're promoting that to our members, and if other agencies would do so as well. Again, much like publicizing 988, we want to make people aware of these resources. This will be my last meeting as your representative from GLMS. It's been a privilege to serve as the representative to the Board of Health. Dr. Chris Jones, who's a transplant surgeon at University of Louisville, will be taking my place at the next meeting, and I'm sure you'll find him very helpful.
Thank you so much, Dr.
Yeah, oh, Dr. Papa, do you know, on the KentuckyCompass.org, is there a copy of that report or is that accessible, any of the data?
Of the maternal mortality, the best place to get that would be from the Kentucky, from the Cabinet for Health and Family Services would have that data. I'm not sure how much of it is actually out in the public domain versus under review. Connie White was the contact there. Probably Lindsay Neese now could get that for you. And I said it's KentuckyCompass.org. It may be KentuckyCompass.gov. But if you just Google KY Compass, you will get to the information.
Thank you.
And Dr. Goldberg, this is a number for women care providers. So they.
Yes, this is not for patient access. This is for healthcare providers. It can be any healthcare provider, physicians, nurse practitioners, mental health professionals, but anybody who needs assistance and support for how do I address this particular problem. Mostly it is a way for getting an on-ramp to follow-up services.
Thank you so much. And thank you so much for this year of service and walking along with us. We truly appreciate your presence and we're looking forward to Dr. Jones' accompaniment. And please join our meetings whenever you get a chance during the morning.
Thank you.
Is there any old business for those board members who have not yet submitted the financial disclosure? Please remember now it's overdue and submit them as soon as possible. And let's keep on brainstorming how can we support and contribute to the Louisville Metro Public Health and Wellness Strategic Plan. Thank you so much for sharing information that we can take into account. Does anybody else has any business? No? So thank you very much. Thanks everyone for taking time to participate in this month's meeting. The next meeting will be held on Wednesday, June 3rd at 8 a.m. It will be a virtual meeting. And if there is no further businesses, the meeting is officially adjourned. Thank you very much. Appreciate it. Thank you. Thank you. Thank you. Thank you.